Dr. Laurie Baudino is a clinical psychologist who focuses on mind-body approach, including dance movement therapy to promote emotional, cognitive, physical, and social integration for kids. So, Dr. Laurie, how did you come to this field?
Long story and short story of it is I've always been a dancer, always been someone that expressed and learned through the body all through my schooling. So I was really fortunate to grow up going to a school that invited where I tap danced my book reports and played basketball to learn math and used movement as an expressive form. And then in my college years, in my undergrad, I was a psychology major and I was a dancer. And I switched from dance performance to dance theory and learned about kinesiology and anatomy and just continued to go about in terms of my master's and my doctorate, really integrating this idea that we hold our emotions and our experiences in the body. So what better way than to support our emotional and psychological health through the body and through movement. And so kept going through schooling.
Exactly. So when you say, especially children, so you'd go through like floor time approach with dance. So how does it go?
Yeah. So actually, floor time is very familiar and consistent with a lot of the theories of dance movement therapy. And the work is, every dance therapist practices a little differently. I use it very much as a psychotherapy. So I'm looking at, how the nervous system responds to experiences in our environment, in our internal environment, and the external environment. And then using movement. So whether that is just looking at body posturing and how we use our facial expressions, how we connect and move rhythmically and connecting to one another, as well as, so that just might be in through our talking, as well as getting up and actually physically embodying what we're experiencing. So if we're talking about a situation, not only talking about it and reading about it and learning about it or watching it, but actually physically looking about what does it look like to enter into that scenario that you're talking about, if it's a child talking about a scenario or a parent-child dynamic about a transition maybe. So it's really about following the child's lead, very much about supporting that it's not only putting labels on a child, but really looking at it as movement and that we have choices and options of how we move and interact with one another.
It's so interesting. And it's, I've been doing floor time for many years with my kids. And I'm a great believer in a body-mind connection and following the child's lead. So I'm just curious, so how would a session be, for example, with a child who will be on the autistic spectrum? So
yeah,
how would you kind of lead it of following his lead? And
absolutely. So very similar to what you're talking about, the floor time model, when we think about, we're starting with regulation. So we're starting with that idea of making sure that internal system and external system is balanced and feeling organized for the child. And so it might look like me having the child enter the room and I'm observing what is their body language communicating. Is there a rigidity in their posturing and in their mannerisms? Is there asynchronicity about it? For instance, maybe there's a quickness and then a slowing down. Is there chaos in this movement where it's kind of a whirling dervish of a tantrum or interaction? And I'm not only observing with my eyes, but I'm also mirroring from a sense of my breathing, also engaging with my own body to physically move the same way. And we start out, most typically, every session is unique, but looking at it in terms of parallel. So I'm moving in a parallel way to the child. I might be putting words to what the child's doing. And then I might be expanding on it. So I actually use the acronym DANCE when I talk about this. So the D is for differentiation. So I'm differentiating, I'm pulling apart, what am I seeing? What am I looking at? And really from like a smaller vantage point of like, okay, the child is autistic and maybe on the spectrum, and maybe they're moving in a specific way. Maybe they're moving a car back and forth, and there's this moving back and forth. And then I'm attaching the movement to a bigger movement. So I'm looking at how is the whole body engaging in this individual moving. So that's the A of the word dance. And then the N is for narrating. I'm saying, oh, this is what I'm seeing. This is what we're experiencing. I'm bringing that C, that consciousness to what we're doing. So in dance therapy, we either expand, we make something look bigger than what we see. We're not just always staying at the same level as a child. Sometimes we exaggerate what we're seeing, or sometimes we minimize, we make it even smaller. So maybe the child's moving a toy and I'm moving it really big over on the side, or maybe I'm slowing it down and moving it really subtly, bringing it to consciousness. And then there's this dance, this engagement of this back and forth that happens. That's the E for that word, dance. So the sessions can look very play-based, but it's adding in this extra lens of all the qualities of what movement it tells us as this parallel process to the emotions. So we'll see a child that will be, let's say, stuck in a pattern of their physical movement, and they'll also be perseverating, maybe stuck on the same pattern. And so it's not about changing it per se, but about understanding it and joining them. And we keep what's working and we modify or expand out what's not working.
And can you explain a bit about like what's the theory of dance in connection to emotional regulation?
Yeah, so there's lots of theories behind it. The form of dance movement therapy was that movement is our innate way of connecting, and that we're using the body. So it's less about dance like we traditionally think about in terms of like ballet or jazz or tap. Of course, dancing is a beautiful art form. It brings about flexibility and strength and partner work. But this really comes from a space of that we're embodying our experiences. And so when we think about dance, we're thinking about dance in terms of movement, breathing, heart flow, about posturing, about that back and forth that happens. And that's what we see of it as a dance.
And what would be your tips about breathing and how to teach children on the spectrum a healthier type of breathing?
Well, I love the field of myofunctional work and looking at oral motor skills and learning more about our occupational therapy world and how all these systems connect together. So I often collaborate with other professionals, and from my research and my observations, it's really supporting the children to get into the nose breathing, to be able to place their tongues at the roof of their mouth and closing their mouths, really relaxing their muscular tension and having more of a consistent flow of breathing through the nose. I'm also supporting the child to recognize how they're moving. So we might increase our sympathetic nervous system, that high arousal state, getting really worked up, getting really busy movement, and then being able to be aware of slowing down and noticing our hand on our heart and our belly and seeing how we're safe in that state. So giving them opportunities to practice those changes.
And can you share one of your success stories of a child on the spectrum that?
Yeah. Well, I typically go to one of my first experiences early on. I have to say, I feel like all my opportunities with children are a success, mainly because looking at movement and therapy, mental health, is about acceptance. And so I always start with a child and they are always seen, they are always accepted, they are always felt like they engage and connect with family members or loved ones. And so every session we see a shift occur. Even if it is just expressing emotions, there's a shift. One of my first sessions was a child who came in and had acculturation challenges, so coming to a new environment, minimal language, had some early trauma experience in her life and was given the diagnosis of autism on the spectrum. And she would typically bang her head, bang objects. She would also have a lot of enmeshment, so climbing onto other people's laps or really being close to people that she didn't know, limited eye contact, limited words. And through I used the analogy of a castle. We built the parameters, we built the floor first. We had parallel play, like I mentioned earlier. So moving side to side with her, she actually initiated where she would come into the room and she would take objects and she would build a fortress around her. She would build a wall. She would kind of protect herself with items instead of looking at it as like, what is she doing or what's wrong here? I also took objects and built my space. So we had two separate spots. Eventually, we grew up in our space to this vertical plane of standing up and peering over at each other. And we really got into this space of ego. Again, I'm narrating for her. I'm using rhythm with her. We're moving together. I'm following what her movement's like. And again, expanding it and giving her more of an awareness of what that looks like. Eventually, she came out of this wall that we built separately. And we started to be able to push and pull and lean in for intimacy in what we call the sagittal plane. Yes. So it's moving forward and back, forward for safety and away for things that are threatening, and having that back and forth with her. Ultimately, we were able to bring in her family members and have them join in with her and do this together, and really reconnect for her, rebuild for her this place of safety through a relationship. That we don't have to come straight into the sagittal movement plane of like connection when we don't know the person, but we gradually move through the movement planes and we connect.
Oh, wow. And I also read that you're involved in a dreams project. Could you tell us a bit about it?
For Andreas Dream?
Yes.
Yes, yeah. So the Andrea Rizzo Foundation is, it's Andreas Dream, and they provide funding, sole funding and support to hospitals, clinics, and schools around the country and the US. And we do bedside therapy at hospitals. So I work at pediatric hospitals for children with cancer and special needs. And we do I do bedside therapy, and we have programs throughout, again, the country. And it's really supporting children that are in their stages of this terminal illness and really supporting them to help with pain management, to help with connecting to family members and the emotions around their illness, as well as just how to express themselves. So often it's hard to attach words to what's going on, but they're constantly communicating through their body. And movement is one way where we have control. We get to decide how we move and how much we move. And so it's really giving them a place of feeling that things are possible when there's so much that is not possible for them.
And your movement programs with you, can people do it Zoom, or do you need to live in Hawaii?
Yeah, so, it's been really unique this time around with the pandemic. I have gone completely virtual for this whole academic year. And it's actually been really wonderful. Of course, I love being in person. I often go and do sessions in families' homes as well as schools. And, I've just continued to do that. So I am more of a person on the wall. So they've got the screen up, but I'm interacting with them in their homes. I get to connect the parent and child together, which is one of my biggest goals, is that I fade away and I give the family all the tools and support they need. So I can see the child in a moment that might be challenging and help the parent and child with that dynamic during our session virtually. I can bring attention to how they're moving. I can communicate to them about the anxieties and the diagnosis and the nervous system and the brain and how it all works. So a lot of psychoeducation. And then the coaching and support of even our language with children, and different strategies that families can use throughout this time.
So how can families contact you?
Yeah, so my website is my name. So it's Dr. Dr. Lori, Lori, Baudino, Baudino.com. And there you'll have my email. And also on I think I'm on all the social media platforms. So I try to keep connecting with everyone. So Facebook and Instagram and Twitter and LinkedIn. And it's all Dr. Lori Baudino. And I also have YouTube, lots of YouTube clips that I try to put out in webinars to keep supporting families.
I'll put a link at the end. So, Dr. Lori, thank you so much for this interesting chat. Really appreciate it.
Anytime. My pleasure. Thank you for having me.